Preservation, marking, and packing of exhibits. Firearm. Firearms are extremely rarely submitted to the pathologist for examination. If so, the pathologist, after examination, may put identifying initials on the gun's frame, receiver slide, or on barrel. Bullet correlate with the clothes. If recovered from cloth, mention the cloth and part of the cloth from which recovered. C. If the bullet nose has received any imprints from clothing. Correlate with the wound. If recovered from the body, it must be correlated with the serial number of wound mentioned in the postmortem report. If several weapons have been used to kill the victim, this would help to correlate bullets with weapons and fatal firearm wound. Mention body part from which a bullet recovered. If recovered from internal organs, mention it. If lodged in bone, excise the part of the bone containing the bullet by sewing. Bend the part manually. Bullet would be dislodged. If bullet is difficult to locate, X-ray of the entire body must be taken. It must have been embolized to an entirely different location. Excessive blood in a cavity, loops of intestine, etc. make it excessively difficult to locate the bullet. X-ray of the body is vital in such a situation. James Garfield was shot at his assassin, Charles Gutte, on July 2, 1881. Since X-ray had not discovered at that time, Alexander Graham Bell, better known for discovery of telephone, was asked to locate the bullet. He used a metal detector to locate the bullet, but his signal was distorted by the metal bed springs. Furthermore, he was not allowed by doctors to use the device on Garfield's left side. Perhaps it was believed to be lodged in the liver. At autopsy, the bullet was found lodged behind the pancreas. 20 years later, at the assassination of William Kingley in 1901, a primitive X-ray machine was available but not used because it was thought that its use would have disturbed the patient and done little good. Describe the appearance of bullet deformed, fragmented, or intact. Also, whether jacketed or unjacketed. Measure the diameter or base of the bullet. In a undeformed bullet gives a good idea about the caliber of the weapon. Weight. Weigh the bullet and mention its weight in the postmortem report. Weights of known calibers are known. If bullet is less than the expected weight, it indicates fragmentation. Other fragments need to be searched. It also acts as a very good check against the switching of bullet during transportation to lab. Dry the bullet. Do not wash. Do not wash. Washing removes tissue debris, DNA profiling, traces of blood grouping, and powder residue from the bullet. Labeling. A. Each bullet recovered from either from clothes or from body should be labeled and preserved in a separate envelope or a bottle, since the bullet may have to be identified in a court of law. It is a must to label the bullet in some way. Bullet must never be marked on the sides. The sides of a bullet always carry the primary and secondary marking. Marking them would make the comparison extremely difficult or even impossible. Postmortem report, date, name, age, sex, area, bullet recovered, corresponding injury, seal, label, glass roof, improper and proper labeling of improper. This is improper, improper. Some authorities recommended marking them at the nose or at the base, but even this is fraught with the danger, as all surface of bullet may carry marks, dirt, or other trace evidences. Weave pattern of clothes are often found on the tip of the bullet. It is best to put the bullet in a plastic or glass container, seal it, then pull label over the container. Each bullet should be sealed separately. The label must mention postmortem number with the date, a name, age, sex of the deceased, areas where it was discovered, and a injury number with which which it corresponds. Autopsy pathologist signature pellet for determining of short sights and the type of ammunition. Only a few pellets are sufficient. Thus, unnecessary time and effort may not be wasted to recover all pellet from the body. This is in contrast to bullet and bullet parts, where all bullets have to be removed. In most cases, the pellets are deformed. Thus, the size of the bullet is difficult to determine. An X-ray, however, must be taken in such cases, which can indicate the extent of spread within the body. It should be signed and attached along with the postmortem report. Slugs, cards, warts may be recovered from the wound. Try and label them as with bullets. Gauge of the shotgun and also the type of ammunition can be determined from the cards and warts. Fired cartridge cases. Initial should not to be put on the outside for the same reason as in bullet. Some authorities recommended signing on the side inside of cartridge, which is correct, but it may be difficult for a marking pen to reach inside the cartridge. It is best to preserve cartridge cases in the same way as the bullet. Clothes, dry, preserve, area of powder tattooing by fastening a cellophane paper over it. Place in a box, seal and hand over to police. Thank you.